Yes, good morning. Kirsten, just want to double check the screen. Oh, there we go. Okay, awesome. Okay, good morning, everybody, and welcome to the 2050 Rural and Human Service Transportation Plans Regional Workshop, focusing on the Northwest Georgia region. My name is Matthew Wilson. I serve as the Mobility Manager for the Georgia Department of Transportation and as the Project Manager for this plan, and want to thank you all for attending today. Just a few virtual meeting housekeeping items. First, we ask that you please keep your mic on mute during the presentation. This ensures that everyone is able to hear the presentation clearly. For those using a computer or smartphone, this is the microphone icon with a slash through it. For those on the phone, we ask that you please mute your phone. As we progress through the presentation, we have a couple scheduled breaks for questions and discussion. Please ask or provide a comment. This workshop is designed for us to better understand rural and human service transportation in your region, and your active participation is encouraged. When asking a question or making a comment during these times, please use the raise hand feature in Teams. This is the icon with a smiley face and hand. Alternatively, you can use the chat box feature to type in your question, which is on the comment bubble icon. Our team member, Jaquita, will be monitoring the hands raised in the chat box during the entire workshop today. If you're on a phone calling in, you'll be unable to raise your hand or use chat box. So during the discussion segments, please ask, we will ask if anyone on the phone would like to speak. Please unmute your phone and begin speaking. If there are multiple people speaking on the phone, we'll identify your phone number and then ask you to speak then. A little bit about the RHST team. The 2050 RHST plan is a 3-agency plan. I will speak more about this in the coming slides. The Georgia Departments of Transportation, Human Services, and Community Health are the plan sponsors. The plan is being developed with the help of the consultant team comprised of AECOM, Cambridge Systematics, and Modern Mobility Partners. A little bit about the agenda. Today, we're going to run through the following topics. I will provide a brief introduction and some background on rural and human service transportation in Georgia. I will then hand it off to Will Brewer from AECOM to review the available transit and transportation services in Northwest Georgia. After, Baird Breen from Cambridge Systematics will walk us through the region's transit needs. And then Kirsten Moat from Modern Mobility Partners will guide our discussion session. We will also have a couple question and discussion points throughout the workshop today. So what exactly is rural and human service transportation? Not many people may be familiar with the terms. So rural and human service transportation, or RHST, are mobility services provided for the benefit of disadvantaged populations, including persons with disabilities, older adults, and persons without a vehicle. RHST includes services provided by the public transit operators, human service agencies, private providers, and public and private nonprofit agencies. The 2050 RHST plan seeks to do a few things. First, we're going to do a general update of the existing conditions information from the previous plan. Then we're going to build upon the recommendations and efforts completed from the first plan to identify projects and programs and policies to meet current and future after 2050 demands and provide enhancements to RHST across Georgia. I mentioned that this plan is a 3-agency plan. This is because the state of Georgia administers 3 systems to provide public transit, human services transportation, and non-emergency medical transportation, NEMT. Each system is administered by a different state agency using different funding sources. GDOT focuses on public transit for rural and small urban populations. DHS focuses on transportation for services for seniors, low-income families, individuals with disabilities, and vocational training, while DCH focuses on transportation to medically necessary services for eligible Medicaid members. Coordination exists at the state, regional, and local level. However, each agency system operates independently using a variety of service delivery models with differing requirements. The state's role in governing transit is primarily to oversee compliance with federal grant requirements. There is no single state authority to set priorities for public transit and human services transportation or to coordinate planning and funding of transit services for rural communities. A little bit on the history of the RHST plan. Back in 2007, the Georgia Departments of Human Services and Transportation completed the Coordinated Public Transit Human Services Transportation Plan. As an update to the plan, GDOT initiated the Georgia Rural and Human Services Transportation Plan 2.0 in 2011. The Plan 2.0 outlined coordination activities among the rural public and human service transportation providers across the state to achieve improved service delivery for the state's public transportation and human services transportation customers. The plan also developed recommendations to implement mobility management at the state and regional level. In 2021, GDOT, DHS, and DCH began developing an update, the 2050 Georgia RHST plan. The purpose of this plan is to provide a framework for additional coordination among Georgia's agencies impacted by mobility services and continue the work of the Technical Coordinating Group, which is now renamed the Technical Advisory Group, and expand its participation to additional stakeholders. A quick look at our plan schedule. You will see that we've wrapped up our vision and goals, which I will discuss on the next slide, and are heavy into our existing conditions and needs assessment and beginning our alternatives analysis. What I want to focus on today is how to get people involved in this process and how we can get input from your region to help us understand needs and develop solutions. The stars on the schedule indicate stakeholder and public outreach events. Those with a pink circle indicate the Technical Advisory Group meetings. Outreach is a key component of the RHST plan and ensures that agencies updating the plan fully understand the rural and human service transportation needs across the state. The Technical Advisory Group, which includes the 3 state agencies sponsoring the plan, as well as representatives from regional commissions, the statewide Independent Living Council, and other stakeholders identified during the stakeholder engagement process. I'm pleased to see a few of them attending the workshop today. We are also engaging stakeholders in the public in each of the 12 regions in Georgia through our regional workshops. And again, thank you so much for being here today. We are conducting a statewide survey for RHST providers and a separate survey for riders, the link to which is on the QR code on the slide. These efforts will provide all Georgians an opportunity to assess the status of the RHST plan and identify key needs and service coordination strategies. Additionally, public feedback will be elicited through the 30-day public comment review period for the draft RHST plan update, which we are targeting for July. The RHST vision and goals are structured from the statewide transit plan, which we updated 2 years ago. Our vision statement outlines where we'd like rural and human service transportation to be in 2050, which is to continue and grow statewide rural and human service transportation coordination to improve the quality of life and economic activities for all Georgians, specifically those in rural areas, those with disabilities, older adults, and persons without vehicles. Our 6 goals, again based on the statewide transit plan, outline how we seek to implement the vision. The first goal is to provide coordinated and efficient rural and human services transportation. The second is to provide a safe and sustainable RHST network. The third is to optimize public transit programs to best meet public transit systems and travelers' needs. The fourth is to ensure public transit coverage across the state to support mobility access for all. The fifth is to connect rural transit to regional and urban centers. And finally, the sixth is to leverage technology and innovation to support public transit ridership and performance. I would now like to hand it over to Will Brewer from AECOM to walk us through the available transit in the Northwest Georgia region. Will?
Great, thanks, Matt. Good morning, everyone. As Matt mentioned, my name is Will Brewer. I'm on the consultant side with AECOM Transportation Planner, and I would like to just provide you with sort of a snapshot of your region and some data that we've been looking at for existing transit, whether it's public transportation that's available in the region or Department of Human Services and Department of Community Health, kind of the service areas around your region. So these 3 maps right here are specific to your region. And so I want to just kind of stress that there is a very high number of agencies within the region. First, I'll acknowledge Mountain Area Transit. It's a multi-county operating system. And so that's Fannin County, Gilmer County, Gordon County, Pickens County. There are a number of demand response transit agencies within the area as well. Bartow County, Paulding Transit, Haralson County, Dade County, Walker County, Whitfield, Murray County, Catoosa Transaid, Chattooga County, and of course the city of Cedartown does operate within Polk County. So a lot of public transportation going on in this region. And as far as DHS services, there are a number of agencies that operate. Just want to touch a little bit on Division of Aging. Division of Aging assists older individuals and other at-risk adults and their families. They are operating within the region, as well as Division of Family and Children's Services, which provides numerous support services and programs to help Georgia families and children in need. And finally, the Department of Behavioral Health and Developmental Disabilities, which provides services for mental health and substance abuse, intellectual and developmental disabilities, deaf and hard of hearing, and suicide prevention. Lastly, on our third map, we just wanted to acknowledge the service area for the Department of Community Health. There are two brokers that operate within the state. In this particular region, this is the North region, and that broker would be Southeast Trans. And I think that may be it. And free to answer any questions moving forward. I think I'm going to hand it over to Baird or Kirsten.
Yeah. So I apologize. I'm on one screen, so I'm trying to share and do this. So first want to just see if anybody has any questions to start with. Okay, so hearing none, we can move forward. So we have a Mentimeter exercise. So if you're on a computer or have a smartphone in front of you, we'd like for you to join us through www.minty.com. That's MENTI.com. Or you can scan the QR code on your screen. And once you do that, there's an 8-digit code that you will enter to connect to our questionnaire, and it is 8620-4925. So I'll give everybody a minute to kind of get logged in. All right, so question number 1. You just saw 3 maps that Will presented on the screen showing the different public transit services, Department of Human Services, and Department of Community Health. Are we missing any services in this region that you are aware of? And if so, what are they? So on your smartphone or your computer through minty.com, it should prompt you to respond with short responses. And you can enter those and submit them, and they will start popping up on the screen. So maybe we're missing a transit service or a transportation service that's provided by a local nonprofit that operates independently from the different programs that we presented today. Maybe there's a church in your area that provides transportation services to senior citizens. It could be anything. We just want to make sure that we are capturing all of the existing services in your area. Give everybody a minute to answer. Did we reflect the services correctly in the maps as far as rural versus urban versus a little bit of both? Okay. Services that help clients in and out of homes and to the doctor and back who are by themselves.
Kirsten, I wonder if you want to put up the map one more time just to show that
Yeah,
slide.
let me see how that works.
Yeah, going back and forth might be a little difficult.
Okay, so just as a reference. So we've got rural public transit in Dade, Walker, Catoosa, Whitfield, Murray, Chattooga, Polk, and Haralson counties. In Floyd and Paulding, we've got urban services, urban transit. In Bartow County, we've got a little bit of both. And then in Gordon, Pickens, Gilmer, and Fannin counties, that's all operated by a coordinated system called the Mountain Area Transit. On the human services side, all of the counties are really covered by aging, DFACS, and DBHDD, so Department of Family and Child Services and Department of Behavioral Health and Developmental Disabilities. There are 4 counties that we are showing do not provide the aging services. Those are Polk, Paulding, sorry, 5 counties, Polk, Paulding, Dade, Whitfield, and Murray. So anything that's incorrect or anything missing. Services to hospitals or other activities to elevate the stress on family members. So just as a clarification, I understand that these are services that you feel are missing, not services that exist that we are not aware of. And if you want to unmute yourself and clarify, that would be great. Okay. So I'm going to move on to the next question. We've got one more. So what are some constraints on your existing systems? Are you constrained that you can't offer as many hours during the day of services? Is there a certain time of day that you hoped you could offer, but you cannot? Do you have constraints on your labor force of your existing system that you're having trouble maintaining your existing level of service because of perhaps driver retention? So any kind of constraints that you're dealing with, maybe it's just funding, maybe you just need more money. Matt, what other constraints can you think of? I mean, I think we can all think of a few.
Yeah, can you go across the county line? Can you
Yep.
go up to access services that may not be in Northwest Georgia? It may be up to Chattanooga to get to a hospital, to a service where you need to go, or across state line to Alabama that may just be not able to get to with the transit service that's available, or down to Atlanta. You know, is there intercity bus service that you need? Is there any other constraints on the system where folks are making trips, or you're making a trip where you don't feel as if your services are being met? And for providers, is this system of, well, we don't have enough drivers to operate the buses that we have? Is it a training issue? Is it a funding issue? Is it a marketing issue where folks don't understand what's available in their region, and we need to do more marketing to get folks to understand what is available?
Yeah, so any kind of need or constraint that you have, we definitely want to hear them. This is all going into our needs assessment, will help us develop programs, projects, policies as a part of the recommendations, and ultimately, hopefully, we can identify some funding for those. Any takers? Everybody's system is operating fantastically.
And I will say, you can always email after the presentation, always email myself or Kirsten, and we can get with you individually about any questions or comments you may have.
Yeah. Okay. Well, we're gonna move on. Continue thinking about some of the issues that you're having. We're gonna have some additional questions for you later. That's going to be more of an open discussion. We're not going to do it on the polling, so we are done with the Mentimeter. And so you can close that out of your smartphone or your computer. And we're going to move on to the needs assessment that Cambridge Systematics is working on. And we've got a couple slides for your region on the estimated transit demand, both existing and in the future. So Baird, I will hand it over to you.
Thank you so much, Kirsten. Good morning, everyone. My name is Baird Bream, and I'm with Cambridge Systematics. My team has been leading the needs assessment for this study. The needs assessment, as Kirsten described, is an estimate of transit demand based on certain demographic factors within your region, both in the present and in the future, in our horizon year of 2050. The needs assessment methodology is based on a methodology that GDOT has used before, which it takes from a research paper produced by the Transit Cooperative Research Program. So this is a methodology that has been applied consistently by GDOT and stands as kind of a national standard practice for this kind of estimation. So even though it's pretty high level, it's looking at the regional level, the county level, it's seen as pretty robust and pretty reliable. Next slide, please. So the way the needs assessment is conducted is using two main assessments. The first is called the non-program demand assessment. That's the one highlighted in blue here. And the other is called the mobility gap demand assessment, the one highlighted in green. And again, both are produced for the present year, which in our case is 2019, since that's based on the most available, the most recently available demographic information, and then our horizon year of 2050. So when I say most recent available demographic information, what I mean is that both of these methodologies rely on data taken from the American Community Survey that is produced on an annual basis as part of by the U.S. Census. And in both cases, we're looking at demographics that are more likely to need transit, to rely on transit in order to just get to where they need to go. So the non-program demand assessment, which is seen as generally the lower bound estimate, is an evaluation of the number of people that belong to these different transit dependent demographics, or more transit dependent, I should say. So that includes people ages 60 and older, people with disabilities, and residents of zero vehicle households, by which we mean a household where no one has regular, consistent access to a private vehicle. The mobility gap demand assessment takes a slightly different approach, where it estimates the difference in trips taken between those zero vehicle households and one vehicle households, which again describes a household in which the members of that household have access to one private vehicle. So the non-program demand assessment, again, that's the lower bound based purely on demographics, whereas the mobility gap demand assessment, the higher bound, is based on travel behaviors associated with those demographics. And we create these two methodologies in order to have kind of a reasonable range of different outcomes in terms of transit demand when we try to estimate it. So in looking at the current situation, we see that across the Northwest Georgia region, transit agencies provided about 239,000 trips in 2019, but the existing rural demand ranged from 298,000 trips all the way up to 818,000 trips, which means there was an unmet rural trip demand of anywhere from about 58,000 to 578,000. What this means is that there were people who wanted to take transit for different purposes over the course of a year, and their total number of trips that they did not get to take ranged anywhere from 58,000 to 578,000 trips. Now, again, that captures a very large range, and that's done intentionally to give a sort of upper and lower bound to try to understand how much more transit service is needed in the area. And the final row shows the total annual costs, both capital and operating, that all the transit agencies operating within Northwest Georgia would need to expend in order to meet 100% of that unmet demand. And that ranges from anywhere from 6.7 million in 2019 to 18.5 million in 2019 under the mobility gap demand assessment. This is essentially, again, just saying what all the agencies operating in this area would need to invest to meet 100% of that unmet demand. We then estimate this demand in the future for 2050, which is based on projections of population growth within the counties of Northwest Georgia. That information on the population growth projections is taken from the Governor's Office of Planning and Budget, which does population projections for every year for every county in Georgia through 2065. And under those population growth projections, we see that estimated rural demand does indeed increase under both the non-program demand assessment and the mobility gap demand assessment, with non-program demand growing to about 360,000 and the mobility gap demand growing to nearly 970,000. And as a result, the total costs needed to meet 100% of this demand increase as well, ranging from $9.2 million to $23.8 million. And again, if that seems like a lot, that's just to meet 100% of all demand. We recognize transit agencies are operating with a lot of constraints, everything from administrative constraints to securing the workforce to simply having the available funding in order to deliver that. So that's just to help us understand how much more demand there is in the area. On the next slide, we show one other element of transit demand, which looks a little different, and that is specifically the commuter transit demand. This is a slightly different assessment, whereas the non-program demand and mobility gap demand assessments focus on the kind of every type of travel need estimation. So healthcare, transportation, education, workforce, shopping and running errands. This demand assessment specifically measures travel between counties for commuter transit, which you can think of as that day-to-day commute for work. This measures people who want to travel, who live in one county but work in another and would want to travel across those county lines in using transit. So this is based on a slightly different methodology than the demographic profiles. This is based on the number of people who work from home, because that home-based work trip is seen as a proxy estimate for transit demand. Essentially, people who could conceivably be using transit for their commuter service because they don't currently rely on an alternative means, but are unable to do so. And the calculations look a little different. They're relying on a slightly different set of data, essentially a combination of GDOT's statewide travel demand model, which estimates travel patterns both within the current year and the forecast year of 2050, and another census data set that estimates this inter-county travel patterns within 2019. And while we recognize a lot of people work across county lines and are crisscrossing back and forth, we focus in this table only on county travel patterns that would generate more than 100,000 trips or nearly 100,000 trips per year, because if you've only got a few dozen or even a few thousand trips going back and forth on an annual basis, it probably doesn't represent sufficient demand to justify the cost of a new commuter transit service. So what we see is that there are a handful of commute patterns across counties that meet that expected level of demand, both in 2019 and in 2050. That's travel between Paulding and Cobb counties, Murray and Whitfield counties, Paulding and Douglas counties, and then Bartow and Cobb counties. And what you see is a range of annual commuter transit demand that ranges from anywhere from just below 100,000 for Paulding and Douglas to several million for Paulding and Cobb. And again, this just speaks to the kind of economic dynamics that exist between these counties, where you're likely to have people traveling from a county with a lot of residential development into a county with a much larger industrial or service workforce footprint. And as a result, you get these variations in demand based on those economic relationships. And as before, this demand also grows in 2050, increasing by about 1.5 million trips for that Paulding to Cobb travel corridor on an annual basis. Other counties have more moderate growth of just several tens of thousands of trips. But again, what it shows is that we see sustained demand for annual commuter transit between 2019 and 2050. So ultimately, it shows that there is a demand for this commuter transit service that is sufficient to sustain the capital and operating costs for such a program. Next slide, please. We want to pivot now to highlight some of the other inputs that we are using to inform this needs assessment. We've been conducting a survey, or a couple surveys rather, that are open to our various stakeholder groups that help us understand the needs for transit in a bit more nuance and detail. So essentially, we've got 2 surveys that are out right now. One is a survey that's gone directly to the transit providers so that we can get the perspective of those providers and understand those administrative and operating challenges in a bit more detail. And then we also have a rider survey, which is going out to members of the public to ask them about their perspectives on riding transit within Georgia and understand what they need and expect from that transit service in a little bit more detail. So to date, we've received 36 responses on the provider survey. We're pleased with that level of response, but we still have the surveys open for another couple of weeks. If any of you haven't taken the survey yet, we encourage you to do so. We encourage you to share it with your colleagues if they haven't. The survey consists of about 40 questions asking background information, asking for an overview of kind of needs and priorities for transit, and then asks respondents to indicate the most significant challenges that they have with administrative issues, rider demand and satisfaction, and funding. And what we've seen so far in the provider survey is very interesting. We've noticed that slightly fewer than 50% of respondents are able to carry riders to destinations outside jurisdictional boundaries. So that commuter transit style program that we mentioned would be likely a struggle for several of these agencies as they currently operate. And related to that, by a ratio of nearly 2 to 1, respondents have not pursued coordinated human services transportation or regional transit service, again, suggesting that they're really focused on meeting needs within their county and may not have the necessary capacity or administrative support to work across county lines. Many agencies reported less ridership in 2020 than in 2019. We noticed we had 6 respondents that had fewer than 5,000 trips per year in 2019, but this has increased to 10 for 2020. Obviously, that's not terribly surprising just based on the impact that COVID-19 had on all sorts of travel patterns and travel demand for 2020, but it definitely suggests that some of these agencies are in it, are working in an operating environment that's more challenging now than it was even just a couple of years ago in the base year that we were doing a lot of this analysis. We asked for input on different technologies that agencies are using as well, and we got some pretty interesting responses. We asked them both to indicate which services they are currently using and which ones they are planning on using. And I think the most interesting one was that we only had 2 respondents indicate that they currently use a smartphone app or a website for trip planning and fare payment, but 8 agencies are considering adopting this tool, which could really represent a significant advancement in their technological capabilities, and specifically in the different tools and services and amenities they can provide to riders. So it could be a really interesting next couple of years for agencies in this area. We heard that the most common state of good repair need is purchasing new vehicles, but the second highest need is establishing regular maintenance schedules. Some respondents indicated that they have trouble hiring mechanics, but also scheduling mechanics because they often share mechanics with other transit agencies or with other county facilities within their region. And so essentially need to wait for those teams of mechanics to come through and be able to service their vehicles, which challenges their ability to have those vehicles in service. This very much overlaps with some of the other challenges we were hearing around attraction and retention for workforce in general. Drivers and mechanics are both in high demand and relatively low supply. Additionally, the other major administrative challenge was compliance with state and federal reporting, which is definitely a pretty common issue that we hear when we look at rural human services transportation. You know, we're talking about oftentimes very small agencies that still have to meet a number of reporting requirements that can be quite complex. The main challenge for meeting our rider demand and satisfaction, however, was expanding service into new markets and then dealing with the public perception of transit. Again, we're not surprised to hear this in COVID, in the COVID era, when a lot of people have been concerned about the risks of contracting COVID on transit vehicles if they're in an enclosed space with a small number of people for a long period of time. So it definitely speaks to the challenge that we're facing right now for the industry. These comments from our providers definitely raise some thought-provoking ideas for us to wrestle with. Next slide, please. We'll move on to the rider survey. So for the rider survey, we've received 55 responses to date. And again, the survey is still open. While we're pleased with the level of response we've received, we encourage you to promote the rider survey among your riders and even among, friends and family. It's a great conversation starter because the survey is open to the public. And in fact, because it is open to the public, we're not too surprised to see that 85% of respondents so far have indicated that they do not currently ride transit. Obviously, that's something that concerns us, because if these people have mobility challenges or mobility gaps, we want them to feel comfortable using transit. We want them to feel that transit is an option for them. So it definitely speaks to, again, the challenges ahead of us of figuring out what exactly motivates that 85% of respondents. And we do have some responses from them that helps give us some insight into the challenges. Among those who do ride transit, their main reason for doing so is that they lack access to a vehicle, and they're often taking the transit either for work, medical appointments, or dialysis appointments. And they indicate that if transit were not available and they had to find an alternative, they would secure a ride from a friend or a family member, which again is very consistent with the literature that most people can secure transportation service in some method through their social networks, but it's often inconvenient or unreliable, or just creates additional headaches for all parties involved. So expanding transit can definitely make a huge difference in terms of expanding mobility in people's lives. Among those who do not ride transit, their most common reasons for doing so are that they are interested, but transit is not convenient, or they simply are not interested, which again speaks to some of the challenges we're working with dealing with that public perception. The challenges for using transit are, again, pretty common to the industry, where that transit is seen as not reliable enough to use for time-sensitive trips like medical appointments. Transit does not go to where they want to go. Again, that might speak to that cross-county or cross-jurisdictional issue. Or the distance to their nearest transit service is too far. They can't reach the stops where transit vehicles would pick them up, or they can't get to a part of the region, the county, where transit service is provided. Survey respondents indicated that the most important transit improvements to prioritize is to connect different parts of the community or region, and to ensure that job sites and healthcare facilities are served. So some pretty clear indications of what the priority trips for people are. And the most important transit technologies to prioritize are real-time arrival information at transit stops and real-time arrival information via smartphone, website, or text. So again, people wanting a little bit more information about the reliability and accessibility of transit. And that concludes what we've heard through these surveys. So again, for those of you who have taken the survey, thank you very much. For those of you who are interested in taking the survey, they are still available. We encourage you to do so.
Great, thanks, Baird. So now we want to transition the rest of our time to discussion. So the virtual housekeeping items are back up here on the screen. If you would, please use the raise hand button if you would like to speak. You may also enter questions into the chat box, and we will pause and answer those questions. If you're on the phone, you cannot raise your hand or use the chat box. But now that we're going into the discussion segment, we invite you to unmute your phone and please ask any questions that you have. So we'll leave it there for a second. Any questions? Okay. Well, we have some questions for you. And we really want your input. It's really important that we understand all of the needs. As Baird said, the surveys are still available. There'll be a link on a website here or on one of the slides here in a minute. But any feedback that you can provide today would be extremely beneficial. Also, you can submit comments and questions to Matt following this meeting up until March 4th. So we'll have his email address on the screen as well, and we will spell that out for anybody on the phone. So generally speaking, you heard Baird talk a lot about some of the needs that we've heard from the surveys. You've seen the demand gap estimations, and the associated costs for those. You've seen estimated commute trips, and that there are going to be more commute trips needed in the future. But what other needs do you have that we haven't heard yet? And for your area, whether you're a provider or a rider, what kind of connections are you looking for? We heard about needing more trips to medical appointments and doctor's offices. We heard that there needs to be more trips to work centers. So what are those missing connections in your county, in your community, in your region? And again, what other needs do you have that we haven't heard yet? Or maybe we have heard it and you just want to reiterate it. And I can't see who's in attendance. Excuse me.
And
But I
here's
think
what I'll do, Kristen, I don't mean to interrupt you.
you
We
should.
have a few people on the line. So if we want to really talk to you personally, we do want to hear your questions or your comments. Let me ask Jessica Roby. Am I saying your last name correctly? And of course, don't forget to unmute yourself if you are responding to Kirsten, Matt, or me. Okay, Jessica. Yes, Jessica is saying yes, ma'am. So are there any questions or comments that you would be willing to add after you've seen this presentation, along with some of the needs assessments and things that we need to know from your region
Yeah,
that we
tell us
don't
what's
know?
going up on. Tell us what's going on up in Dade County.
And then while we're waiting on Jessica, again, Jessica, in case you're trying to talk to us, please make sure you unmute yourself. I'm going to be asking some other people as well. So get your questions ready while we talk to Jessica. Jessica?
She doesn't have.
Okay, so Jessica says she does not have a mic. Okay, well, don't forget that you can also submit your questions in the chat box. So let me go to someone else while we try to see if we can get a question from Jessica. What about, let's see, Ruth Ann Waters? There's also Rhonda Crisp. Rhonda, do you possibly have a question or a comment that you want to add? Don't forget to unmute yourself in case you are. And then there's also Ruth Ann Waters.
I'm going to throw some other questions up here as well. So this isn't about missing connections, but this is about coordinated systems. You know, things like is coordination in your region an option? Do you have the political will for a coordinated system? Do you have counties that are talking to one another and kind of thinking about it? You do have a coordinated system among some of the counties, but they don't include all of the counties. If you haven't really thought about it, or you have and you've decided it's not for you, you know, what were some of the obstacles that you were facing? Why are you deciding not to have a coordinated system? Or you want a coordinated system, but there's some challenges that are in the way that are really tough to overcome. What are those? You know, these kinds of issues that you're having are the ones that we really want to hear about, so that we can, you know, come up with some solutions and you know, include them in some recommendations and work with GDOT to figure out what kind of funding might be available. For those that haven't been tracking the new funding authorization, there are lots of programs that are brand new, and a lot of programs that are specific to multimodal transportation. So some of your challenges, especially if they deal with funding, there may be some new options out there to get these things funded. So we want to hear what your challenges are.
And Kirsten, I'll add right here where Jessica says she doesn't have a question, but she did want to articulate that Dade County does provide aging services for DHS.
Okay, great. Yep, we want to hear that kind of information too, because we certainly don't want to make a recommendation to add aging to Dade County if they already have it.
I think this is a perfect time. Again, I don't want to call anybody out, but just in case, if you have a comment or if you have a question, all of the information that you provide or the comments is really helpful for our team in gathering necessary information to make things better. So we do appreciate your comment, Jessica. And if there are any others who have comments, who have questions, and even if you think it's a silly question, we don't mind answering it, because you know, all of this is a part of the information gathering process. And the only way that we can do that is to literally hear from you. So
Yeah.
again, if you're by phone or if you're in the chat box, if you want to raise your hand, please feel free, because this is the perfect time in order to do that. We really, really, really need to hear feedback from you in your county so that we can make things better.
Yeah, maybe it's as maybe it has something to do with your scheduling. You know, Baird talked about the technologies and how some of the agencies are looking into scheduling software. Um, maybe your county isn't really interested in that. I know when I was working on this project 10 years ago, you know, they were talking about integrating trapeze scheduling, and a lot of the counties and a lot of the systems said, you know what, we like using pen and paper to schedule our appointments. We feel comfortable with that. Our drivers are comfortable with that. So we're going to stick with that at this time. Maybe that's still the case, or maybe you are interested in, you know, pursuing some sort of scheduling software. Matt, I don't know if you want to give a little plug to the Let's Ride.
Sure, absolutely, anytime. And so GDOT is looking and promoting the Let's Ride rural transit brand. So in the future, looking to expand using the Let's Ride logo on all of our rural public transit vehicles with our providers. And also there is a mobile application that's available to rural transit providers to allow your riders to download and use an app to schedule and book their transit trip on your vehicle. So it makes it easier for riders to access these rural transit options. And that's an available option for any rural transit provider in the Northwest Georgia region. And so we'll also be providing marketing materials and other materials to help get that service set up. Also, just note from the folks that are on the call, if there are questions or comments that, you know, just want to have an individual conversation, that totally works for us too. Just, you know, send me an email, send me or Christian an email, and we'll definitely get with you. If there's information that we present that they have questions about that that Baird or Will presented, you know, please don't hesitate to reach out to us. Not everybody's a talker, and that's okay, especially in the morning. But I just want to make sure that what we capture is accurate, what we report in our final document is accurate, and also identify needs. So part of this is understanding what your region's needs are. You know, we are not experts. We can do the research and we can do the surveys, but you know, people who run the system, people who use the system, we want to hear from those kind of folks to better understand their needs and what we can do to help improve service in the Northwest Georgia region.
Yeah.
I also want to add that Jessica just mentioned again, she says she likes software, would like to have more funding. We are very isolated with the mountains and cannot go to all of the areas because of time.
Okay.
Thank
That's
you for
great.
that, Jessica.
Great feedback. Thank you.
Yeah, that's a very good point about rural service. It's not like urban service. Rural service can take an hour to get one way. So it's a very big issue also when it comes to the number of drivers that an operator has and the number of vans or buses an operator has. It limits how they can move those fleets around to optimize their system, especially if they're doing a multi-county system. So that's a really big concern, and thank you for noting that.
Yeah, that's great. Matt, I remember when we were at the Georgia Transit Association conference, we talked to a few people in, I think it was the city of Rome, and they discussed some challenges that they have with jurisdictional boundaries and wanting to be able to expand outside the city. I know that I don't think that they've joined us on the phone today to really speak to that, but you know, it's those kinds of things too. You know, if you've got not only trying to operate just within the county because it's rural, it's mountainous, the trips take a while, but you know, these regions are pretty large with lots of counties. So, you know, especially up in Dade and Whitfield counties, you know, if you're trying to make trips or you see a demand for trips up to Chattanooga, I would imagine that could be a big challenge too.
Yes, if there's for folks seeking to increase service areas, you know, there's a couple of administrative boundary issues that they sort of deal with in that. City of Rome had mentioned they wanted to expand to the county, and the county had some issues with that, and so always have those little local issues with expanding transit service sometimes. But Chiquita, I think you wanted to. I see you trying to jump in here a sec.
I'm sorry, say that again, Matt.
I think, were you trying to jump in? I want to make sure I had an opportunity to give you
No,
time to-
you're good. I was actually going to go down the list one more time and just call out any names that I see, just to make sure, because the main factor is that we really want to get the feedback from everybody who's here on the call. So of course, Jessica has been very instrumental in helping us in regards to questions. Rhonda Crisp says that not everyone has a church member or family friend to help clients get ready in the morning and get in and out of their home, or a home health agency to help. Therefore, there are several clients that cancel appointments and do without. What can be done to help these clients? Again, this is from Rhonda Crisp. Thank you so much for that question. Either one of you want to answer that, or do you want me to submit the question one more time?
Yeah, no, I've got it in front of me, and I think that's a really interesting point. So if I understand correctly, they're booking trips, but then they're canceling last minute because they don't have somebody in their home or wherever they are making the trip from to help them get ready in the morning, and can't make the trip in time because they're not yet ready. So what can be done to help those that need help getting ready in order so that they can be prepared for the trip that they need to take? I think that's a really interesting question. I don't know that I necessarily have an answer to it today, but I think that's a very interesting need. It's all related to transportation, but the need is, assistance before, maybe after a ride. Okay.
And Ron just said that is correct.
Okay. No, that's great. Thank you. We're going to take that back. And Matt, I think that's a great question to open up to our technical advisory group the next time we meet with them. A lot of our technical advisory group members are some of these support services. They're the Independent Living Council, they're the Hospital Association, they're the Department of Behavioral and Developmental Disabilities. So they may have some solutions, or they may have some services that are available. So we will take that back, and hopefully we can get that answered.
Absolutely, and that's a very good point, an issue we've not heard yet. So thank you so much for raising that. It's something we need to think about as well.
Ruth Ann Waters, we haven't heard from you, and we don't want to end this before we hear a comment or a question from you. Do you have anything that you want to add, or a possible question or note that we need to be aware of? Feel free to, again, unmute yourself, or you can leave it in the chat box. And we want to reiterate that. Let's just say after this workshop is over, and let's say 2 hours from now, you remember, I should have asked this question. You can, of course, still provide your information to us, and we definitely want to be able to respond, or possibly get the information that you need in regards to your question. So Ruth Ann, anything that you want to ask or comment about?
While we're waiting for that, I'm also curious to hear from Rhonda and Jessica on cancellations. Are cancellations a big problem for y'all? Are you getting a lot of cancellations, especially last minute cancellations? Okay, looks like Ruth doesn't have any questions at this time. I'll let Jessica and Rhonda respond in the chat if they're having issues with cancellations or high volumes of cancellations. Matt, you want to go ahead and finish out the presentation?
Yeah, it'll be good, and also give them time to type in any questions they may have as well. So just to review one more time on the schedule, we're working on the existing conditions assessment and the alternatives analysis now, and we'll start the development of the draft final report in the coming months. We're targeting July for publishing the draft final report on our website for public comment. And next slide for me real quick. Once again, I just want to thank you for your participation this morning and the first of these regional workshops. So thank you so much for helping us test out the flow and the information that really helped us too. Again, please don't hesitate to reach out to myself or Kirsten with any questions or comments you may have after the presentation. Also, if you haven't, please complete the survey that's on the screen there for both writers and providers and share it. It's also on our website listed there as well. A link there is there to the survey. And then if you're on the phone, I don't think there is anybody on the phone, but maybe somebody. The website is www.dot.ga.gov/transit. And my email is mawilson, WILSON, @dot.ga.gov. Just also ask if you have any questions or comments, please submit them by March 4th, so we have time to include them in our report and also to respond to them in a timely manner. Finally, one other thing, just to sort of note that the GEORGI Transit Program is working on a statewide intercity bus study, so you may hear more information about that coming up as well, and information on the website if that's a topic you're interested in. Again, thank you so much for your time this morning, and with that, I'll double check one more time if there are any questions or comments. Let Jaquita and Kirsten take a second to make sure.
I want to mention that Rhonda says that there are more cancellations than they'd like. We have clients that also need someone at the doctor's office or having a procedure, and due to everyone being scared of COVID, the COVID issue, or if they do not have anyone to go with them, it's causing a lot more cancellations as well. That's from Rhonda. Thank you, Rhonda.
Thank you.
Yes, that's a big topic about how to make transit safe. How to ensure that there's safety with how we travel due to COVID, the flu, any other sort of pandemic related issues. So it's a really good point, and something that we've the Georgia Hospital Association is on our technical advisory group. The cancellations for doctor's appointments is a big deal. It hurts them as much as the patient isn't seen as well. So both groups want to reduce that number of cancellations. So what we can do to try and identify strategies to resolve that is going to be a significant topic.
Okay.
Any other thoughts? Nope. I'll let Kirsten and Jaquita close out then if there are any.
Yep, I'm gonna stop sharing my screen. Well, we just want to thank everybody for joining today and your participation and the feedback that we got from you. It is going to be vital for us to identify some programs and some projects and maybe some policies to help address some of the issues that you have. So again, this is really kind of the critical moment. Anything you want us to know about the challenges that you have, now is the time up until about March 4th, and then we'll be rounding out the needs assessment. We'll be evaluating programs and policies and projects and coming up with our draft recommendations, which will be in the draft report, which will be available for public comment, but that won't be until July. So if you've got something now, we want to hear it. Please let your colleagues know in some of the other counties or some of the agencies that you work with to either take the survey, visit the website. They can watch this presentation. We will be posting it on the website. Submit their questions, comments, concerns. We just want to get the word out to as many people as possible.
And again, please feel free, if you have any questions that you think of later on the day, don't hesitate to submit those questions, and we'll be more than happy to provide those answers for you as well. Kirsten?
All right. Well, I think with that, we will conclude this stakeholder meeting. So appreciate you attending, listening, providing your comments, and we look forward to talking to you again soon.